Hello everyone, this is Rajamanikam Antonimuthu from QPT. More than 20 million Americans undergo colonoscopy screenings every year, and in many of those cases, doctors end up removing polyps that are 2 cm or larger and require additional care. This procedure has greatly reduced the overall incidence of colon cancer, but not without complications, as patients may experience gastrointestinal bleeding both during and after the procedure. In hopes of preventing those complications from occurring, researchers at MIT have developed a new gel, GastroShield, that can be sprayed onto the surgical sites through an endoscope. This gel forms a tough but flexible protective layer that serves as a shield for the damaged area. The material prevents delayed bleeding and reinforces the mechanical integrity of the tissue. In an animal study, the researchers showed that the GastroShield application integrates seamlessly with current endoscopic procedures and provides wound protection for 3 to 7 days, where it helps tissue to heal following surgery. The researchers have started a company called BioDivik that now plans to further develop the material for use in humans. Routine colon cancer screenings often reveal small precancerous polyps which can be removed before they become cancerous. This is usually done using an endoscope. If any bleeding occurs during the polyp removal, doctors can cauterize the wound to seal it, but this method creates a scar that may delay the healing and result in additional complications. Additionally, in some patients, bleeding doesn't occur until a few days after the procedure. This can be dangerous and may require patients to return to the hospital for additional treatment. Other patients may develop small tears that lead the intestinal contents to leak into the abdomen, which can lead to severe infection and requires emergency care. When tissue reinforcement is required, doctors often insert metal clips to hold tissue together. But this can't be used with larger polyps and aren't always effective. Efforts to develop a gel that could seal the surgical wounds have not been successful, mainly because the materials could not adhere to the surgical site for more than 24 hours. The MIT team tested dozens of combinations of materials that they thought could have the right properties for this use. They wanted to find formulations that would display a low enough viscosity to be easily delivered and sprayed through a nozzle at the end of the catheter that fits inside commercial endoscopes. Simultaneously, upon tissue contact, this formulation should instantly form a tough gel that adheres strongly to the tissue. They also wanted the gel to be flexible enough that it could withstand the forces generated by the peristaltic movements of the digestive tract and the food flowing by. The researchers came up with a winning combination that includes a polymer called pluronic, which is a type of block copolymer that can self-assemble into spheres called micelles. The ends of these polymers contain multiple amine groups which end up on the surface of the micelles. The second component of this gel is oxidized dextran, a polysaccharide that can form strong but reversible bonds with the amine groups of the pluronic micelles. When sprayed, these materials instantly react with each other and with the lining of the gastrointestinal tract, forming a solid gel in less than 5 seconds. The micelles that make up the gel are self-healing and can absorb forces that they encounter from peristaltic movements and food moving along the digestive tract by temporarily breaking apart and then reassembling. The gel can also withstand the low pH and enzymatic activity in the digestive tract and protect tissue from that harsh environment while it heals itself, underscoring its potential for use in other gastrointestinal wounds at high risk of bleeding, such as stomach ulcers, which affect more than 4 million Americans every year. In tests in animals, the researchers found that every animal treated with the new gel showed rapid sealing, and there were no perforations, leakages, or bleeding in the week following the treatment. The material lasted for about 5 days, after which it was sloughed off along with the top layer of tissue as the surgical wounds healed. The researchers also performed several biocompatibility studies and found that the gel did not cause any adverse effects. BioDVIC is now working on further developing the material for possible use in patients. In addition to its potential use in colonoscopies, this gel could also be useful for treating stomach ulcers and inflammatory conditions such as Crohn's disease or for delivering cancer drugs. Thanks for watching this video. Now you can get my ebooks with a huge discount at www.rajamanikam.com by using the discount code QPT. Contact me if you are interested in earning a 50% commission for selling my ebooks. Thanks.